My name is Paul Leong. I'm a facial plastic and reconstructive surgeon. I practice in Pittsburgh, Pennsylvania, in the United States. Well, I don't think that's a good idea. This is something that we've evolved through in the United States. I think if you look at any area of medicine, it could be orthopedics or obstetrics and gynecology, over the last 20, 30, 40 years, across the world, certainly in the United States, there's been greater and greater levels of specialization. And I think very few people argue that a greater degree of focus on a particular area of medicine leads to greater expertise, more people contributing to the ideas that are used to help patients, and just better outcomes for patients. And so if I understand correctly, this is an effort to limit a number of other specialties, including otolaryngology, facial plastic surgeons, to practice some procedures. But it's very clear in the United States and in other places in the world that this specialty that focuses specifically on facial plastic and reconstructive procedures and doesn't do any other plastic surgery procedures, they have brought a tremendous amount of innovation and a tremendous amount of quality to the care of patients. And again, it's simple common sense. If you have a well-trained physician who goes through rigorous training and then focuses completely onto a certain area, it is common sense. They're likely to do excellent work and to contribute to the overall understanding of these diseases and these problems that trouble some of our patients. I don't know if I can speak to that specifically, for instance, in the Mexican context, because I am not familiar with all of the intricacies of training of Mexican otolaryngologists. What I would say is that it is very important, and the onus is on our community if we're going to want to practice in these areas, which, mind you, it's important to note, we have done so for generations. Many of the original innovations, the surgical work, people like Dr. Gillies and what have you, these were otolaryngologists. So this is not a new thing that we're wanting to do. But I would say that it is very important, if we're going to want to have the trust of the public, that it has to be very clear that there's very rigorous, very comprehensive training in these particular procedures that we wish to do. And that's something that over the last 40 years has been developed. For instance, the United States. There are 45 fellowships in the United States. It's extremely competitive to get into these fellowships. And it's, again, if you go to the basic common sense of this, when we emerge from our training as facial plastic surgeons, simply the numbers of procedures we have done, whether it's a reconstructive surgery on the face, whether it's a rhinoplasty, whether it's a facelift, whether it's a cosmetic thing like a brow lift, the numbers that we've performed are multiples, many multiples, not like 2 or 3 times. I mean 5 times, 7 times, 8 times what for instance, general plastic surgeons have performed in these areas. And that is a matter of public record. And so I would say that knowing that ourselves and presenting that information to the public is very important. And if that does not occur, if that is not in place at the present time, then that's something that needs to be in place before we can legitimately make these kinds of claims and requests.